Patients generally are fearful for a number of reasons. I mean, there commonly has been a very negative prior experience. It could be the obvious one of they were hurt by a dentist who didn't use adequate anesthesia, who didn't listen to them when they said that they felt something, et cetera, et cetera. Often it's even fear of belittlement or ridicule by a dentist or hygienist. And that happens often in patients who might have avoided going to the dentist because they've had some negative experience. Then they avoid it, put it off, and they want to come and take care of themselves, but now they're fearful of being belittled. And so the fear of belittlement almost supersedes their initial fear of pain that caused them to avoid it in the first place. Fear knows no socioeconomic boundaries. Somebody could be very successful today from a very humble background, who might not have had great medical care as a child growing up and had a fortuitous situation develop through their education or careers that put them in a power position, or they become a celebrity, etc. But that doesn't make them immune from the past or any of their past experiences. I have CEOs of major Fortune 500 companies who cower in the dental chair. Celebrities are known personalities, but we don't treat them any differently than anybody else. That's what kind of makes them realize we're human as well.
It's usually a past experience, a negative experience the patient's had in the past that triggers the phobia. If the dentist belittles the patient or humiliates them after a bad experience, it compounds, it adds insult to injury. Those types of things end up having a very lasting impression on a patient, and they can make patients avoid dental care for years due to the fear of the pain and the humiliation they suffered during that treatment experience.
A very large component of dental fears is the lack of sense of control that patients have in a dental chair. They're laying down, they're having surgical procedures done in an awake state. They can't necessarily communicate at great levels with instruments in their mouths and water and suctions, etc. Fear of choking, fear of gagging. Basically, they give up a lot of control. And that sense of lack of control is a very, very big component that is often not recognized in treating fearful patients. Fears can be learned vicariously. People don't have direct experiences and they just pick up fears from their parents saying things. The first time they take them to a dentist, oh, don't worry, there's nothing to be afraid of. Well, a child, they have no basis to be afraid. So now the parent is trying to be a good parent by saying that, yet they've just planted a seed of potential fear. Obviously, the media and all the portrayals, menacing portrayals of dentists, marathon man, etc., add to all those things.